By the end of the month, the state expects to have enough doses to inoculate more than 383,000 people.
Healthcare workers and long-term care facilities are going to get top priority. And our political editor, Dennis Welch, is in our newsroom tonight with more on that. Hi, Dennis.
First shipment of doses are expected to arrive in Arizona on December 13th, and the director of the state health department expects that the vaccine will start being administered within 48 hours after that arrival. Now, that is good news for everyone here in Arizona in the long term, but given the fact we are seeing those big spike in cases right now, will this help us in the short term?
It won't have any impact whatsoever.
University of Arizona researcher Dr. Joe Gerald telling Arizona's family that the initial round of vaccines won't slow the current rise in coronavirus cases. Last week, he released a dire report that says Arizona is on pace to run out of hospital beds by the end of the month.
What we need is broad availability of the vaccine within the general population. That won't come until sometime later this spring. And so we'll be able to protect our healthcare workers with this first round of vaccine, but we won't be able to do anything to appreciably slow transmission of the virus within the community.
The state's health director, Dr. Kara Chris, explained that it could take another 3 to 4 months before enough of the vaccine can be produced for widespread distribution.
We anticipate hundreds of millions of doses by like March or April, and that's when we feel that it will finally be open to where we'd be able to get to the general population.
Health experts estimate that 65 to 70% of the population needs to be inoculated before achieving herd immunity, where there is widespread resistance to the virus. And Chris said that could take most of next year.
It's probably going to be like the summer, early fall before everybody who wants it has had an opportunity to go get it and go get both doses.
And it's extremely important to remember that after someone receives their first vaccination, they will have to return about a month or so later to get a second dose for this to be truly effective. In the newsroom, Dennis Welch, Arizona's Family.